In selected cases, only temporary eyelid eversion is desirable. The first major indication is in the management of young puppies affected by breed-related entropion which have not yet reached an age approximating adult musculoskeletal conformation. Delaying definitive surgical intervention will help minimize the risk of overcorrection. The second major indication is in the management of adult animals that have reached musculoskeletal conformation but have developed a vicious secondary cycle of painful keratitis, entropion, and self-trauma, which needs to be broken in order to facilitate corneal healing or pending more definitive subsequent surgical correction. The use of a topical anesthetic agent will help differentiate conformational from secondary or spastic entropion. Temporary eyelid eversion is performed using either non-absorbable 4-0 to 5-0 suture material or, as in this case, surgical staples. Using either technique, the eyelid should be rolled out sufficiently to prevent trichiasis and corneal irritation. The use of this technique in the management of more complex forms of entropion is potentially best left to the more experienced ophthalmic surgeon. When performing temporary eyelid eversion using surgical staples, the eyelid tissues are firmly stabilized using the surgeon's finger. Eyelid tissue is rolled out sufficiently to correct the entropic component. This may be facilitated by the use of a wooden Q-tip prior to initial staple placement. Staples are placed individually, starting centrally, and the remaining lid length is then divided. Unsatisfactory staples should be removed and repositioned as necessary during this procedure. The seating of individual staples may be adjusted using hemostats. Temporary eyelid staples should be removed in 4 to 6 weeks or prior to more definitive surgical correction.